Start this evening off by leading the Pledge of Allegiance. I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So with that, I will hand it off to Angie to give her opening remarks. Angie, it's all yours.
Well, thank you so much, Maureen, and welcome everyone. It's indeed an honor to be back with you this month for our virtual town hall. I always start each of my town halls by recognizing our nation's veterans. As I've said many times before, too few families understand the sacrifice both by the veteran, by the active service member, by those who are left in the family behind to think and worry about them. So again, thank you so much to our nation's service members. And I also just want to say thank you to the National Guards, guardsmen and women who serve the state of Minnesota and of course across our nation. This has been a really challenging last couple of years. We all know that. I always start before we come live by telling my public health expert that I look forward to the day where we don't need a public health expert at our town halls, virtually or in person. But I'm so pleased that you're here with us, Dr. Wertz here this evening. Thank you so much. And Maureen, thank you for the leadership of the Dakota County Chamber over the last couple of years, especially. It's been a real honor and a privilege to serve our business community and our local chambers as a member of Congress. Obviously, I worked on the Paycheck Protection Program a couple of years ago. We worked on the EIDL loan program, and Dakota County and every county chamber, as well as all of my city chambers, have been at the table helping craft the legislation required to keep our businesses open. And I'll just mention a statistic: 93% of the businesses in the 2nd District of Minnesota are considered small businesses. So when I talk about small business being the heart and the soul and the engine of Minnesota 2's economy, that is backed up by statistics and backed up by the people that I work with every single day. I had the opportunity to speak today in Burnsville to the Burnsville Chamber and sit down with some business leaders afterward to talk about the key issues that we're facing now as as Omicron peaks, comes down, as we work to keep our economy open. And I want to talk a little bit more about that here this evening. Again, Dr. Rebecca Wertz, thank you so much for being here with us from the University of Minnesota's Public Health Department, because to me, there really is only one priority that we should be focused on as a Congress, as a nation right now, and that is how do we continue to manage the COVID-19 public health crisis and also the economic crisis that has resulted in as a result of COVID-19. And that has led us to a number of different issues that we're dealing with in the Congress and here locally. For those of you who are joining for the first time, thank you so much. I committed that I would come meet with you on a monthly basis if I had the honor and privilege of representing this district. This is the 37th town hall. We've done that in person. We've done that virtually to be safe. We're looking at those positivity rate numbers here in Minnesota come down over the last week, and I'm very excited to see that, but we're not quite below the 5% threshold in Minnesota where we would consider getting you all in person back together, but we're looking forward very much to that day. We'll get started with questions and answers here in a minute, but since this is my first town hall of 2022, I just want to give you a little bit of an update and say I hope that your new year is indeed off to a good start. Over the last year, we talked about in December that we were able to do a couple of things that we've been trying to do for a very long time in this country. And the first is really the bipartisan infrastructure bill. I was incredibly pleased to see that get across the finish line. The other was getting vaccinations in arms, especially in the older community. I know that this is a new normal with COVID that we're all dealing with, but boy, what a difference a year can make, and access to technology and vaccines can make when you're dealing with this new normal of Omicron and the pandemic. You know, over the last 3 years, I've done everything I can to make sure that I'm on the ground listening to each of you in my communities, talking to my mayors, my county commissioners, my boards of education, all of you, to make sure that I know what's going on and what you're thinking in our community, really the challenges of hardworking Minnesotans that you're facing each and every day. That's why I've been so vocal in Washington over the last little bit to encourage the administration and members of Congress to focus on the COVID-19 pandemic, making sure that we have ample access to testing, ample access to appropriate masks, to make sure that we're doing everything in our power to encourage vaccinations in that 5 through 11 population, booster shots, everything we can to address the public health crisis we find ourselves in, but also encouraging this Congress to really focus on the economic issues as well. I am very aware that gas prices and the price of groceries and meat especially is way up, that this is a global pandemic that is inducing global inflation. And so I think that's one of the reasons why I helped found on a bipartisan basis the Supply Chain Caucus in the US Congress. So we again announced that caucus last week in a press release to Democrats, to Republicans. And it's why I'm going to keep working on these kitchen table issues, making sure that we lower the cost of healthcare in this country. For example, I'm not giving up the fight for Medicare to negotiate its prescription drug prices, because I really do believe that that is the right thing to do for America's seniors. I'm not going to give up the fight on a number of these key issues. So I've been listening to you. I know there's an element of frustration out there. We need to bring forward in this Congress a bill that's going to address these supply chain issues. We need to be looking at making sure that we're putting resources toward testing supplies and being able to manage the new normal of this pandemic just as well as possible. So that's what I'm going to be focused on in 2022. There are also some really additional critical issues that we need to find a way forward on. Things like the John Lewis Voting Rights Act. We need to find our way, and many of you know I've been leading this fight since my first term in Congress on stopping members of Congress from being able to buy and sell individual stocks. This is an issue that I believe fundamentally would help restore confidence in your Congress. Many of you know I have committed not to do that as a member of Congress, sell or buy individual stocks, as well as other key Washington reform items that, again, I think that our constituents need to know we're here to serve you, that there is no other reason and no personal benefit from serving in the US Congress. So lots of things happening. A lot of focus on legislation right now to ban members of Congress from buying individual stock. One of those bills is my bill. I'll be working across the aisle to do everything in my power to help make that happen, to restore this confidence. So Dr. Wertz, again, thank you for being here. I'm going to turn the podium over here to you to make some opening comments, and I'm looking forward to all of your questions this evening.
Thank you so much. And it seems hard to imagine, but the first case of COVID in the United States was January 20th, 2020, which means that last week we started our third year of the pandemic. So I'm really grateful to Representative Craig for the chance to answer questions and provide information about where things stand. And I certainly don't take it personally that you don't want to be in a position to invite me back. We're definitely moving in the right direction, but we have a ways to go to get out of the woods. And I'm eager to answer questions for your constituents.
Great. So I believe we're now going to enter into our question and answer. So this question is for you, Angie. Ryan asks, can you tell us more about the bill to ban members of Congress from trading stocks?
Well, thanks, Ryan. I mentioned this in my opening remarks. You've seen a number of members, quite frankly, on both sides of the aisle, move toward introduction of legislation. My bill specifically is the No Stock Act. It is actually a resolution that would change House rules and not allow members of Congress to buy or sell stock. And many of you know I introduced the Humble Act, which is a little bit broader bill that would ban members of Congress from owning stocks, from serving as lobbyists after they're done serving their constituents, ban first-class travel. The reason I decided to also introduce this essentially House rule change is because I think it's an opportunity for members of the U.S. House of Representatives to be a role model and example that we'd like to see over in the Senate. We've seen way too many examples of really questionable stock purchases by members of Congress. And first and foremost, our constituents need to understand and need to see that we're working on behalf of their best interest. The rule change would not require overcoming the filibuster in the Senate. So I'll also add that that seems a more straightforward rule change, seems more attainable at the moment. Although I have reintroduced the Humble Act as well that would completely ban in law. There are other pieces of legislation out there. Other members have also included for public debate the idea of requiring members to put any individual held stocks into a blind trust before entering the U.S. Congress. I think all of this debate and discussion is healthy, is good. And again, we need to make sure that the American people, that Minnesotans know, we are there only to serve their best interests, not for personal profit or gain. And I think we are really causing an erosion of confidence in from the American people in the U.S. Congress when we're not willing to stand up and say, yep, I'm willing to do that.
Thank you, Angie. This next question is for Dr. Wertz. What are the long-term effects of COVID-19?
And that's a really interesting question. It seems very common. As many as half of the people who get COVID have prolonged symptoms after. During illness, many people with COVID have had symptoms such as tiredness, difficulty breathing, chest pain, sore joints, loss of taste or smell. And those are some of the symptoms that seem to persist in people for extended periods of time, months and now even a couple years. I think one of the scary things about COVID is the number of organs that it affects and the number of unexplained and very complete, total body engagement or affect because of the infection. There are clinics at the University of Minnesota and other clinics at Mayo that are addressing and providing care for the people who have these long-term symptoms. But at this time, it's unclear how long those symptoms will persist. For many people, they seem to resolve after several months, but for other people, they've persisted for years at this point.
Thank you, Dr. Wertz. Our next question is for Angie, and this question is from Kim, and Kim asks, I am very disappointed by the lack of traction on drug pricing as a mother to a child with T1D, especially with inflation causing prices of all other goods and services to increase. With BBB as a non-starter, what can we do to transform drug pricing in America?
Well, Kim, thank you so much for that question. I share your disappointment. Many of you know that I spent months working to get Medicare price negotiation in the broader bill, which is something that I've been fighting for since becoming a member of Congress. And of course, even since running a self-insured health plan at my former Fortune 500 company. I've shared before that I literally ran a plan that covered around 18,000 covered lives in the US. In a self-insured plan, it means that the company paid directly the bills for compound drugs, for specialty drugs. So I've been an active proponent of addressing drug prices by either creating more competition to stop this practice that brand name drug companies have of keeping generic players off the market. I've been an active supporter of looking at our prescription drug patent laws so that we can't just keep extending the life of a patent forever and ever. We need to allow more competition. I've said to the administration, I've said to my own leadership that I would certainly want to see an active effort to look at the elements that were in the larger package on a standalone loan or carve out basis. The elements of that package that deal with lowering the cost of healthcare are among some of the most important in there. And of course, you mentioned type 1 diabetes. The other two elements that I am an active supporter of is a monthly cap on insulin cost. We all know that it really is pennies to manufacture and produce insulin at this point in the life of that particular technology. And it's just extraordinary how much manufacturers continue to charge. And then last, I'm a big supporter of capping the cost of prescription drugs annually for America's seniors. So, the particular piece of legislation you talked about may not be headed anywhere over there in the Senate, but I can assure you that I'm going to keep fighting each and every day to lower the cost of and continue to expand the Americans and Minnesotans' access to health care.
Thank you, Angie. This question is for Dr. Wertz. The new COVID variant seems to be less severe, but more contagious. Does that mean that this might turn into a more common low-grade illness like the flu?
I think that's exactly the direction that we're heading in. In general, we seem to be past the peak of Omicron. There are lots of indicators that we're past the peak of Omicron, but that doesn't mean that it's going away. It doesn't mean that COVID is going away. COVID is not going away. And I think that the future is learning how to manage ongoing or recurrent outbreaks of COVID, most likely more common in the wintertime, or most likely more common after holiday seasons when we're gathered together and we spread the newest variant among ourselves. But the immunity that we've acquired through vaccination, through widespread infection, suggests that we're starting, at least in the United States, this isn't true in the rest of the world where a lot of the population is not yet immune, but at least in the United States, that we're moving toward what has been called endemic disease, which doesn't mean it's milder, which doesn't mean necessarily that it's any less problematic than a serious flu outbreak would be, but it's something that we're going to learn how to manage and that we're learning how to manage now.
Thank you, Doctor. This question is now for Angie. John asks, I remember drug price reform was a cornerstone of Donald Trump's platform. Can the Trump base be persuaded to support this effort, or has it dissolved into another red versus blue issue that will get stuck in the mud?
Well, John, thank you for the question. I want to just remind everyone, since I came to Congress almost 3 years ago, I've worked really hard to support a number of bills that are bipartisan. In fact, 80% of the bills that I am either authored or co-sponsored at this point are bipartisan. They have both Republicans and Democrats on them. I would like to think that we could have a good public debate and come to some measure of agreement on drug price reform. I will tell you, though, that I don't think anyone appreciates just how aggressive the drug lobby is until you get to Congress and you see it in action and up close. Many of you know that I have been pretty candid that I am willing to wear brand name drug company attacks as a badge of honor, because if I'm advocating for a reduction in cost of drugs through increased competition, that ought to be something that many of my colleagues across the aisle can agree to. So, I'm not going to give up. I'm not going to stop being optimistic that we can continue to find some common ground on this particular piece of legislation. But we do have to see this as more than a zero-sum game of if one party passes reform, somehow the other party loses. If Americans win, if Minnesotans win, it shouldn't matter what political party brought it forward. And so I supported a lot of legislation under the previous administration. In fact, the former president signed 4 of my bills into law. And I'm going to keep working with anybody in Washington who has a good idea that I think is the right thing for our district.
Thank you, Angie. This next question is for Dr. Wirtz. We're approaching the second anniversary of the initial lockdowns for COVID-19. Have we seen any data to suggest that we're any closer to ending the pandemic?
And I think there's a lot of data. The number of cases in the country is decreasing. The positivity rate of testing is decreasing. I think people are normalizing the behavior of wearing masks, of being more thoughtful about going to work or school if they have symptoms of a respiratory illness. We have access to tests a lot more than we did even during the holiday season. So we're starting to learn the behaviors that we need to implement to move this from being a pandemic to being a more seasonal, recurrent respiratory infection like the ones that we've all experienced over our lives. So I think there's a lot of indication that we're learning how to manage COVID as an ongoing seasonal respiratory virus.
Thank you, Doctor. This next question is for Angie. Linda asks, now that the tax season has begun, what can Congress do to address the IRS backlog?
Oh, wow, Linda, what a great question. Some of you may have seen that I announced this week something called the IRS Reform Initiative on my team, because we are going to be fairly aggressive in calling for the administration to address this backlog. I'll try to remember the numbers off the top of my head here, but 6 million is the number I recall from 2021 that have not been processed so far. So we're talking about the 2020 returns, excuse me. We're talking about over 2 million unprocessed quarterly business returns. We're talking about something in the neighborhood of more than 2 million amended returns that have not yet been processed. And of course, yesterday was the start of the new tax season. 20 weeks is just not, it's not acceptable. And I've said to the administration, I've asked to meet with the customer service experience officer from the administration. I know I'm in the process of scheduling a meeting with the taxpayer advocate. Part of this is a backlog due to COVID-19. Part of it is part of a larger trend of issues of workforce staff shortages. But whatever we need to do to help the IRS get caught up in processing returns from the last tax season, from adjudicating these amended returns, and just make it a lot better experience for my constituents. I have to tell you, this is one of the most common issues that we receive outreach from our constituents as members of Congress. If you have a tax issue, you can reach out to my casework team at my district office in Burnsville, and we will try to help you get in touch with a group called the Taxpayer Advocate Services and resolve your IRS issue. You know, I could probably take the rest of our town hall to tell you all of the ways in which I'm, not happy with the Internal Revenue Service right now, from a 30% answer rate when you call the IRS helpline, to the amended returns that have not yet been processed from the prior tax year, in addition to the child tax credit portal. So this is something that I've asked my team. I've got a staff member who is dedicated and focused on understanding these metrics. We're going to be sending letters. We're going to be writing legislation. We're going to be proposing solutions to how we can help the Internal Revenue Service get through some of this backlog, but it's unacceptable, and it really needs some attention from the perspective of the American people.
Thank you, Angie. This question is for the doctor. If you have been vaccinated, boosted, and contracted COVID, are you basically fully immune, or at least for the time being?
And that's a great gloss on that question, at least for the time being. You're as immune as you can be, having gotten several doses of immunity through vaccination and a dose of immunity through infection. That doesn't mean, as we've seen at least with 3 doses of vaccine, that you can't get a so-called breakthrough infection. You can certainly get a breakthrough infection after 3 doses of vaccine. However, fortunately, that breakthrough case is likely to be non-life-threatening. It's ranging from asymptomatic illness to a bad respiratory infection that knocks you off your feet, much like a bad case of the flu might do. And I would bet a lot of your constituents, Representative Craig, have had recent COVID infections, just because it is so ubiquitous out in the community these days. But at the moment, you are as fully immune as you can be. 4th doses of vaccine have been recommended for people who are immunocompromised. My husband has had a kidney transplant, and his next month will be 6 months after he received his 3rd dose, and a 4th dose has been recommended for him. Whether 4th doses will be recommended for the rest of us who don't have an immunocompromising condition isn't known yet, and there will be information about that forthcoming certainly over the next several months based on research studies.
Thank you, Doctor. This next question is for Angie. Can you tell us more about your Rural Health Advisory Council and how regular folks can be involved? Is there a way to receive updates about the group's discussions?
Well, thank you so much for the question. It's one of my favorite activities that I do. I have a small business advisory council. I have a rural health advisory council. I have a family farmer advisory council. And on the rural health side, it is a number of individuals throughout the 2nd District who have some segment of responsibility for healthcare, whether that is running a senior center in the district, whether that's running a health facility or hospital in a more rural part of the congressional district, whether that's providing supportive senior housing to individuals, or transportation to folks who have some health needs. It really is an opportunity to come together and hear from the experts on the ground in the district, because I can't be here every single day. I have to be in Washington at least a little bit voting on legislation. So we try to keep folks updated on the discussion and the work from the Rural Health Advisory Council in our weekly newsletter as much as we possibly can. But whoever asked the question, if you're interested and if you have some healthcare background or adjunct opportunity to provide some input, we'd be happy for you to reach out to our staff and express that interest. We're always looking for good candidates to serve on our advisory councils. And, you know, this is particularly important to me because I serve on a select committee on economic disparity and fairness and growth. And what continues to emerge, my specific focus is on rural communities and family farmers. What continues to emerge is how important it is to have a sector of the economy in these rural communities across America dedicated to healthcare. Not only is it important from a community perspective, that particular service, but also from a jobs perspective. So this is an area where I appreciate the interest. It's certainly something that I'm going to continue to work toward and on, understanding the needs and introducing legislation to address rural health issues.
Thank you, Angie. This question is for Dr. Wirtz. John asks, just heard that another COVID subvariant has been found in the US. Any thoughts yet on its implications for the pandemic? We seem to think, as we have with every variant to date, that once Omicron peaks, we're home free.
And that's a great question and a great observation, John. I've heard about that variant too. I've heard it called Omicron's little brother, or Bromicron, I guess, as a way of giving people a name to attach to it. I think that there will be variants forever with Omicron or with COVID, as there are with the influenza virus each year and with other respiratory viruses. That's what viruses do, they evolve. I think that we will learn, and there may be a day where we have almost like a weather report. We have a report on the status of new variants of respiratory illnesses that will cause us to temporarily modify our behaviors, whether that means wearing a mask when we take the train to work, or being more thoughtful about how we expose our loved ones who are older or who are immunocompromised. We may take that and have that information in a more real-time kind of way and have it, modify our own behavior on a week in and week out basis. But variants are here to stay, and not enough information about this newest variant, but I think it always makes sense to treat a new variant with caution and respect until we have more information about it.
Thank you, Dr. Wirtz. All right, this question is for Angie. Karen asks, we have a family member in a rehab facility. They are overwhelmed and are understaffed while they do amazing work. What can be done in real time to provide support to frontline workers in the medical field?
Well, Karen, thank you. Thank you so much for that question. It's just a great question, because we have had really so many heroes on the front line of this public health crisis, whether they be healthcare workers, whether they be folks who work at our senior centers, whether they be grocery workers, and of course, we can never forget Minnesota teachers and those who are trying to keep our schools open and our kids in school learning where we know they learn best. So, I know the state is in good discussions at the legislative level on how to distribute the hero pay that really the federal government has distributed a lot of money to the state of Minnesota and our local municipalities and counties. And I'm very hopeful that the state will make a robust decision to make sure that we reward workers such as those you mentioned through the state legislature in a fast capacity as we begin the new session. The other thing that I would mention is, staffing shortages and issues. When you have a fast moving variant like we just experienced, I don't know about you, but family, extended family, at the professional level, just so many folks either with the Omicron variant or exposed to it here in the last little bit. So it has been a real challenge, specifically in service sector type roles in healthcare and in senior centers, just to keep folks coming in and working every single day. We talked a lot about public policy, and as I think about what at a more broad level we could do to unleash a generation of workers who want to go to work, to me, one of the smartest investments with the biggest payback and return we can make as a nation is in pre-K for 3 and 4-year-olds, because you are creating the next generation of educated Minnesotans who are going to be tax-paying individuals. And today you would be unleashing a workforce who may or may not have the ability to seek and pay for childcare right now, that currently is not in the workforce. So those are a couple of my immediate thoughts. Again, one of the reasons we prioritized sending help to the state and to counties and to cities across Minnesota and America is because we believed, and I still believe, that they are in the best position to decide where those resources should be going.
Thank you, Angie. This question is for Dr. Wirtz. Linda asks, will we need another booster for COVID?
That's a great question. And let me just respond briefly to Karen's question about healthcare workers. There's several really amazing state-based programs to rapidly train and deploy certified nursing assistants, which are moving people along the education pipeline much more quickly than we've done in the past. Of course, in order to make those jobs attractive for people, we need to compensate the people who take on those jobs and make sure that they get the respect that they deserve. But with regard to Linda's question, it's almost certain that we'll need future doses of a COVID vaccine. As I mentioned earlier, I think it's clear that people who are immunocompromised, people with kidney or other organ transplants, people who are receiving cancer chemotherapy, will be recommended to have a 4th dose as their 3rd dose wanes. We know that immunity due to the vaccine wanes over the space of about 6 months. And so certainly there's the clear recommendation that people who are at most risk for COVID get a 4th dose. Whether the rest of us will get a 4th dose 6 months after our 3rd dose, our booster dose winds down, is not clear yet, but almost certainly we'll need future doses of vaccine, probably vaccine that's been modified to represent the newest variant. So stay tuned for the 4th dose for those of us who are not immunocompromised, but almost certainly will, and we may even combine the influenza vaccine and a COVID vaccine in a single dose of vaccine given each fall.
Thank you, Doctor. This question is for Angie. John asks, I hope big chunks of the much needed Build Back Better legislation, especially the climate change elements, will be passed. What's your sense of the chances?
Well, John, thank you for the question. It's a great question, and I certainly am a huge supporter of addressing climate change by reduction of carbon emissions, and of course building our resiliency as well across the country. There's just really no debate that what we're seeing around the country right now with some of the natural disasters, whether they be wildfires, whether they be flooding, droughts like we experienced, severe droughts as we experienced across the Midwest, indicate that we are seeing an acceleration of climate change that we really have to address from a public policy perspective. More specifically, I think some of the infrastructure elements as it relates to addressing climate change have the best support, and we'll see those continue to be debated. We'll see those potentially in a reconciliation bill down the line, whether that is electric vehicle infrastructure, which we know is important, whether that is biofuels infrastructure, which I worked with family farmers from the district to make sure that there was nearly $1 billion in biofuels infrastructure in that particular piece of legislation. I have continued to advocate for, introduce legislation around year-round sales of E15, ethanol, extending the biodiesel tax credit and things like that. So John, I know that this is just a huge priority for the administration. It should be a huge priority for the country. And we also know the cost of inaction. I mean, you look at what's happening across our nation, look at what happened here in Minnesota over the summer with the drought. And we've just never seen the kind of widespread Midwest drought that we saw this past summer. And so I think we really have no choice as a nation but to address these emerging issues. And so I'm going to continue to be optimistic. You know, I know it's a challenge. Those of you listening here today, when you think about overcoming the filibuster in the Senate, but I'm going to continue to be optimistic that inaction is just not an option for our nation, and continue to advocate for what I believe are common sense policies that most folks in our country do support.
Thank you very much, Angie. This next question is for the doctor. How can we protect our children who are attending school in person?
And this is such a critical issue. I mean, of all the disruptions that have happened with COVID, having kids' education disrupted, I fear is going to be one of the most long-lasting and difficult to overcome disruptions that we've experienced. I think to protect our kids and their teachers, the support personnel in schools, it's so important for kids 5 and older to get vaccinated. So important for the teachers and the other personnel in the schools to get vaccinated. I will say that school design, school structures are built to effectively, this is the first rodeo for infectious diseases in schools. Sorts of infection control measures, including floors that are easily cleaned and surfaces that are easily cleaned, and ventilation in classrooms. It's required to be at least 10 air changes per hour. And so the underlying ventilation in any certified school building is adequate and more than adequate. So to the additional measures of kids wearing masks, of the teachers and providers around them wearing masks, and trying to optimize and maximize vaccination in the whole school population is going to be super important toward feeling confident in moving school back to school.
Thank you very much, Dr. Wirtz. Our next question is for Angie. Linda asks, as a member of the supply chain caucus, how do we get the backlog at our ports moving?
Linda, it's an absolute great question. And I think some progress has been made over the last month or so with respect to getting those containers unloaded. There are a number of different issues. I think, having the National Guard assist in some of those activities, some legislation we passed related to maritime, and making sure that our port system is open 24/7 have been really important activities. I honestly haven't had a chance to look at the bill since we got on our town hall about 30 minutes before I came onto my town hall here this evening. The America Competes Act of 2022 was announced. And that is it's a bill that we have been asking House leadership to bring forward. It's a bill that already has passed the Senate that will help with our supply chain issues, and in particular competitiveness with China surrounding the topic of chip technology, strengthening U.S. manufacturing, and strengthening our supply chain. This is, again, an issue that over the last couple of weeks, we've really been asking the administration, asking House leadership to focus on what all of you are most concerned about, and that is obviously the supply chain issues that are exacerbating the inflation issues that we have in our nation, some of the competitiveness issues to incentivizing U.S. manufacturing, looking at global consolidation and some of what's happening in the meat processing sector. I'm a big advocate for let's unleash competition. Let's make sure and give our opportunities for family farmers to create co-ops, to create smaller regional meat processing facilities. This is an issue that I've discussed with my ag task force that really is looking at how to create competition and unleash it. So, Linda, it's a super big challenge that we're facing. We're also, the truth is, with such reliance on China, with such reliance on Southeast Asia for imports as a nation, my personal belief is we've just got to continue to incentivize American domestic manufacturing and make sure that we are diversifying and reducing the risk of having our supply chain in just one region of the world.
Thank you, Angie. This question is for Dr. Wirtz. Are children under the age of 5 ever going to be able to receive a vaccine? And I have a granddaughter who's 3.5.
My kids are grown, thank goodness. I can't imagine how frustrating and scary it's been for parents throughout this outbreak. You know, the Pfizer vaccine, there was an announcement a few weeks ago that the early trials in kids 2 to 5 years old, the results were not what Pfizer had hoped. It actually worked quite well in kids younger than 2, but not as well for the 2 to 5 year olds. And it may be, you know, as we know with our routine vaccinations for kids, it often takes a total of 3 doses to get kids to where we need them to be to have lifelong or certainly prolonged immunity to some of the infectious diseases that we worry about. So Pfizer is going on now and testing a 3rd dose, but it's delayed, unfortunately, the results, the data that would be necessary for the FDA to approve the vaccine. The hope is that by April, that 3rd dose data will be in, and the FDA will move quickly as they have before to authorize vaccine for kids younger than 5.
Thank you, Dr. Wirtz. This next question is for Angie. Mary asks, will you explain why the voting bill says no ID and ballot harvesting is fine and basically federalizes voting with all mail ballots? Also, why did my Medicare payment for Part B go up 15%?
Mary, thank you so much for being here this evening. And I'm going to do a point of personal privilege here since Maureen mentioned her 3.5-year-old grandchild. I can't get through a whole town hall without mentioning Noah, my 3.5-month-old grandson, who is doing great. And Dr. Wirtz, we talked about a new normal before we jumped on here. And it's hard to think about a day where we ever didn't wear masks when we were around newborns who'd had no vaccines yet. So anyway, a point of personal privilege. Mary, back to your question specifically. I think the 2 pieces of legislation that you're referring to have to do with the Freedom to Vote Act as well as the Voting Rights Act. And on point number 1, the Freedom to Vote Act, this was a bill that Senator Klobuchar has really led that would provide some set of what I would call minimum standards for voting across our nation, whether that be the option of voting by mail, absentee ballot, drop boxes, whether that would be early vote locations, whether that would be at least a minimum amount of time in federal elections that you have polling stations open on weekends for folks who like my son who works, not a standard 9 to 5 job like many people do, and have the opportunity to just take off and go to the polling location. Of course, it also would make a federal election day a holiday, a federal holiday. All of this is really aimed at giving everyone a voice in our nation and an opportunity to cast their ballot. And in fact, many of the parts of the Freedom to Vote Act are actually not as generous with those timelines as what we have here in Minnesota. I always say that Minnesota is sort of ground central for good common sense. The rest of the country is really asking for the option to look more like Minnesota when it comes to access to the ballot box. On the Voting Rights Act, many of you know that the Voting Rights Act has been renewed so many times on a bipartisan basis. In fact, many of the folks in the Senate who voted against restoring the Voting Rights Act recently, or even to begin debate on that, voted for restoring the Voting Rights Act under George W. Bush. So, it really has always been a bipartisan issue that we want people to have access to the ballot box. And of course, my own personal view is we don't want to create a voting situation where anyone is advantaged. We just want to make sure that no one is disadvantaged. And if a jurisdiction or a state puts a law in place that disadvantages particular communities, that there is some sort of recourse for that. Your second question is around your Part B premiums, I believe, if I recall. One of the things, I'm going to look down here and use my cheaters here, because I pulled out a letter here when you asked this that I sent to the administrator for CMS around this issue. And for those of you not as familiar, CMS announced a 14.5% increase in Medicare Part B premiums in 2022. And that increase was put in place as a result of the arrival to market a particular Alzheimer's drug. And so, I helped put pressure on the administration, on CMS, related to this particular issue. Completely agree with you. The increase is egregious. We've asked the administration and CMS to reconsider that Medicare Part B premium increase. And Mary, you have my absolute commitment that I'm going to continue to fight like hell to reduce that premium increase. In fact, just putting pressure on the administration to reduce that increase that was proposed caused the manufacturer of that particular drug to come down in short order. So, Mary, I'm all over this issue, and I will. I'll promise you this: I'm not going to stop fighting until we figure out how we make prescription drugs, brand name drugs, more affordable, until we unleash some more generic competition into this marketplace, until we have patent reform to deal with many of these issues. And I believe that we should cap Medicare prescription drug cost for our nation's seniors. And I have a number of other bills in 2022 that I'm going to be introducing that will address senior concerns.
Thank you, Angie. This question is for Dr. Wirtz. Are you seeing a difference in trends of COVID infection in Minnesota as compared to the whole country? Are we better or worse off in other regions?
Well, we seem to be getting better, certainly over these last several weeks. So as we've seen before, sometimes for unexplained reasons, a certain region of the country will catch on fire with COVID, and then it will slowly get better for reasons that are not completely obvious. But I liked what Representative Craig said about Minnesotans having common sense. I think people have responded to the serious increase in cases over the holiday season by changing their behaviors, wearing masks, staying home, and we're seeing the consequences of that. And yes, we're seeing it out of proportion in a good way in Minnesota compared to other parts in the country.
Thank you, Dr. Wertz. All right, this is our last question of the evening, and this question is for Angie. Neil asks, what is your response to the mask mandate in Rochester public schools going fully online with the known impact of students' mental health?
Well, Neil, let me start with the last part of your question. I think that we need to be doing everything in our power to keep that positivity rate down in each of our communities in order to keep our kids in school and learning in person as much as humanly possible. I'm the mother of 4 boys. My youngest son is a freshman in college, but he spent the last couple of years, as you can imagine, like so many students out there in either a hybrid or an at-home learning environment. It has dramatically impacted the mental health of our students across our nation. So I've said from the beginning that the local school districts really need to be in full control over the rules. And a lot of that depends on what's going on with the positivity rate in each of our communities. Minnesota is parts metro, parts rural, parts a little bit in between, and that we need to follow the science and make those science-based healthcare decisions. So I continue to believe that, and I continue to believe that we need to do everything we can to keep our kids in school in person just as much as possible. And toward that end, I would just say that the more a community is vaccinated, the more precautions are taken, the better we can keep that positivity rate. And I'm so happy to see the Omicron virus peak and begin to come down. Seeing that above 20% a week and a half, 2 weeks ago here in Minnesota, now down, I think at the last report, somewhere at 7.7%. Rochester's not in my district, so I don't have a particular opinion. But what I do know is that each of my school districts are doing their level best to keep students in school as much as possible. And I would be fully supportive of keeping that as our trend.
Well, thank you very much, Angie. And thank you all so much for joining us this evening. And I also want to thank both you, Representative Craig and Dr. Wertz, for all the work that you do, and your insights tonight have been so helpful. And I have also enjoyed being your moderator for this evening. Now I'm going to turn it back to Representative Craig for some closing remarks.
Maureen, thank you so much. I'm going to keep this really short and mostly say thank you so much to Dr. Wertz, to you, Maureen, for your steadfast leadership of the Dakota County Regional Chamber of Commerce. Thank you to all those small businesses out there. I've said this publicly a few times, but we will be introducing legislation here in very short order, really focused on what I referred to earlier, the 93% of businesses in Minnesota too are small businesses. And I am going to propose lowering the federal tax rate for our nation's small businesses from 21 to 18%. I think that all the work that we've done to really save our small businesses with the Paycheck Protection Program, with the EIDL loan. All of that was started under the prior administration, the help and support we've given to make sure that as many of these treasures in our community survive has really been super rewarding. So thank you, Maureen, for all the work you've done there. Again, a shout out to all of our healthcare heroes, those folks who are working in our senior centers, our nursing homes, assisted living communities throughout Minnesota too, and throughout Minnesota. Thank you so much for everything you do. Thank you to the parents out there. This has been an especially challenging time, I know, for our students, for our children. Thank you to our teachers who I know are doing their level best to keep our kids in school, as well as those administrators who are in charge of running these schools. So again, I know it's been tough. I will always be open to your ideas. So if you have any from a policy perspective, please feel free to reach out to my Burnsville district office. In the meantime, thank you for joining us this evening, and I look forward to our town hall next month. Good night.